Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Have there been any cuts to frontline health services since he became Minister?
Honourable Tony Ryall.
Mr Speaker, the government's goal is that New Zealanders will have better, sooner, more convenient health services, and as we improve the public health service over time, patients will see changes in how frontline services are provided. Demand for services changes over time as populations change and providers change. There will be more of many services and occasionally there will be less of other services. But there will always be more money going into health budget and more services overall. We've increased the health budget and frontline services are increasing.
The Honourable Ruth Dyson.
Is he satisfied that 86-year-old Miss Muriel Mowat of Lower Hutt, who can't change the sheets on her bed, can't hang out her washing, clean the bathroom, toilets or floors, or vacuum her home, has had her home support hours cut in a move described by her nephew as bullying? And how does that stack up against his promise to have no frontline health services cut?
The Honourable Tony Ryall.
Speaker, I don't have the details of that case, but what I can advise the member is that I've been assured that no one will be unsafe or unable to stay in their own home as a result of this review of home support services.
Dr Paul Hutchison.
Thank you, Mr Speaker, to the Minister of Health. What reports has he seen of claimed cuts to health services, and what response, if any, has he seen to these claims?
Honourable Tony Ryall.
Mr Speaker, I've seen a number of recent claims of cuts to access to GP services, including one from a Ms Ruth Dyson. This wrong claim was discussed in an editorial in the influential magazine New Zealand Doctor, which said, why does Labour Health spokesperson Ruth Dyson act as though she has no understanding of GP fees? I find it hard to understand why Mrs Dyson persists in spreading misinformation. Labour appears so disingenuous, it must leave people wondering how strong a grip it has on health policy. It's all a bit fishy, said the New Zealand Doctor.
The Honourable Ruth Dyson. Order. I've called the Honourable Ruth Dyson.
What does he say to the district nurse who said publicly that she has been forced to cut hundreds of health checks for the elderly and was now seeing those same people being admitted to hospital, costing the health board even more in the long run? And how does that stack up against his promise to ensure that nurses had more say?
Honourable Tony Ryall.
Mr Speaker, how it stacks up is that this government has put an extra $750 million into the health budget this year. We've produced a record number of elective surgeries, we've got more people getting cancer treatment, and we've got faster emergency departments. We are investing in the priorities that New Zealanders have.
Quit. Ian Lees-Galloway.
Thank you, Mr Speaker. Did the Minister realise that in making his unreasonable demand on Mid-Central DHB to find $9 million worth of cuts, that those cuts would be to frontline services, such as rehab for under 65s, sexual health services, diabetes intervention and support, dialysis services to older people, and 24 AT&R beds in the Horowhenua?
Honourable Tony Ryall.
Mr Speaker, the member is quite right to identify that we have inherited a very worsening situation at the Mid-Central District Health Board. And look, I have to say that this financial uncertainty is making it hard on the staff and the community, despite the government increasing Mid-Central's budget by $26 million last year. I must advise that member that the best way to secure the long-term future of health services in the Mid-Central region is to get that DHB onto a solid financial footing. I am not prepared to let the Mid-Central District Health Board limp on and put its long-term sustainability at risk.
Ian Lees-Galloway.
How many more frontline jobs?
I apologise to the honourable member. Look, I just can't hear. There's too much noise. I say to government bench on this occasion. Ian Lees-Galloway, I apologise.
Thank you, Mr Speaker. How many more frontline jobs will Mid-Central DHB need to cut before the Minister is satisfied that they are abiding by his demands?
Honourable Tony Ryle.
Mr Speaker, all district health boards are required to get better value for money and improve frontline services. We've given the Mid-Central District Health Board another $26 million, but they have been unable to reverse the decline that we inherited from the previous government. The best way that he, as the opposition's most effective associate spokesman on health, could do something for his region, the best way that he could do for his region, the best thing he could do for his region is to support getting those services onto a long-term sustainable footing. Harping on about the problem is not going to fix it and secure the services that he and I want for his community.
Question number 7, Sandra Gowdy.
Thank you.